Here are 4 things that I would never do as a doctor focused on longevity, and a couple of things might surprise you because they're things that people actually do trying to be healthier. And number 1 is I never forcefully crack my neck, and I don't let anyone else do it either. A sudden forceful twist or even having your head tip way back in the sink like at a hair salon can tear the inner lining of one of your arteries running up your neck to your brain. And that's called a dissection, and it can send a clot to your brain and cause a stroke even in healthy young people. And in rare worst cases, it can cause locked-in syndrome where someone can be fully awake but unable to move anything except their eyes. So if my neck is stiff, I just stretch it gently, but I wouldn't let anyone forcefully twist or crack or manipulate it. And number 2 is I don't spend hours around loud music or loud noises without protecting my ears. And I was definitely guilty of that when I was younger. Music turned all the way up in my earbuds, or going to loud concerts or football stadiums, especially college football. But hearing loss is one of the biggest and preventable risk factors for dementia. Even mild hearing loss is tied to about double the risk of dementia, and severe hearing loss up to 5 times the risk. And it doesn't take long. A concert or a college football game can easily hit 100 decibels, and at that level, damage can set in about 15 minutes. So what I do now is I just bring earplugs to loud events. You can still hear things, but it minimizes the damage. And number 3 is I don't do cold plunges, and that includes dunking my face into ice water, which has become a popular way to reset your nervous system. And that's because sudden cold immersion like that activates 2 very powerful but opposing responses in your body. The first one is the cold shock response, which makes your heart race and your blood pressure spike. And on the opposing side, you have your diving response, which does the opposite and slows your heart down. And when both happen at the same time, it's called autonomic conflict. And that electrical tug of war can trigger abnormal heart rhythms, including something like atrial fibrillation that can predispose people to strokes and other dangerous heart rhythms that can be rapidly fatal. Now, brief and supervised cold exposure is usually well tolerated if you're healthy and fit, and there may be some benefit to gradual cold exposure. But if you have heart disease or high blood pressure or heart rhythm issues like long QT, the risk can be much higher. And the problem is a lot of people don't know if they have one of those, so they don't know if they're high risk. So the way I see it is whatever potential benefit I may get, the risk, even though extremely small, is just not worth it. And number 4 is I don't take green tea extract. Now, I talk about green tea all the time in my videos, and I'm a huge fan, but the concentrated extract is a completely different animal. Those pills cram in mega doses of catechins, the antioxidants in green tea, and when they're concentrated like that, they can start injuring your liver. And in some people, they've caused liver failure that needed a transplant. So my advice is drink the actual tea, but I would skip the concentrated extract.